Hi, I'm Simon Smale. I'm a gastroenterologist based in York. Welcome to More Than Just Medicine. I thought today it would be useful for me to talk about probiotics, in particular probiotics in relation to irritable bowel. I'm a big probiotic fan for other reasons, which people who work with me will know about. But I thought it would be useful to review the evidence in irritable bowel and how they might work. Um, and what we know and what we don't know. So, to start with the definition, probiotics are essentially bugs, things that we eat that are alive, that have a beneficial effect on our health and well-being. That may not be just in our guts, but also in our autoimmune diseases that we're predisposed to, and possibly even in our mental state. There's some quite good evidence about that now evolving in respect of developing other illnesses related to psychological factors. Now, in respect of gastroenterologists, when we talk about probiotics, we're usually talking about a range of bugs, including lactobacilli, where there are a number of different lactobacilli, a group of bugs called bifidobacteria, some strains of E. coli, and a bug called Saccharomyces boulardii, which has been used in a number of contexts. There are a number of commercially available products. VSL3 is one. There are a number of others as well, but the most important thing is that people have a probiotic with enough bugs to get to the colon and have an effect on the bugs that actually live in your bowel, because many of the products that people use and are purported to be have positive effects contain bugs which would be good for you, but unfortunately many of them often get killed by the gastric acid in our stomachs. So that's something to be borne in mind, just how many bugs are in the mixture you're taking and whether those bugs are going to be killed by gastric acid. So in terms of the mechanisms of how probiotics work, actually it's fascinating. This is a story that we're just beginning. It shouldn't come as any great surprise that the bugs that live in our guts have an influence on the diseases we get. After all, there's more bacterial DNA in us than there is human DNA. So the mechanisms of how probiotics work, well, they may work by preventing the binding and invasion and the growth of other much more harmful organisms, because if they're occupying the space that those organisms want, they prevent them from taking hold. Secondly, they may improve the function of the barrier that the intestine is supposed to have to prevent movement of bad stuff, of bad bugs and their components across into the body. Lastly, or not lastly in fact, the bugs may have positive effects on the immune system. Now, it's really fascinating. Different species of lactobacilli, for example, have different effects on different inflammatory mediators. We don't entirely understand which ones do what, when, and why, or which ones you should necessarily be taking in that regard yet. So, there are also some bugs that appear to change the way we perceive pain and other noxious stimuli in our guts, perhaps by stimulating the production of cannabinoids by our own enteric nervous system. That's really fascinating. So, in respect of irritable bowel, I'm afraid to say there are lots of trials, but lots of them are not very well designed, and so there aren't really conclusive evidence in this regard. Generally, the published studies show a positive benefit, as you might expect, for patients with irritable bowel, and that may be because all of the probiotics have a positive effect, or it may be because people have a tendency, a bias, towards publishing positive studies, unfortunately, even now. Nevertheless, they do appear to show a benefit in most studies, and looking at the kind of subgroup analysis, the analysis of smaller groups, it seems that the effect is probably more positive on diarrhea than on constipation. There also appears to be some positive effect on pain. One of the things I would comment of patients that I've had using probiotics, one of the side effects can be bloating, so that people just need to be aware of that. So, in terms of what we know, we are on a journey. We know that probiotics have positive effects. We don't yet know which species do what, in which dose, and which people should be taking which species, because we don't know enough about either the bugs or their effects on individuals. There is a thinking that perhaps analysing people's microbiome, so the bugs that live in their gut, and trying to give them the bugs that they're missing compared to normal people may be a way forward. But we're really at the start of this journey, and we'll try and keep you posted here on More Than Just Medicine as we go. We look forward to people producing positive studies in this regard. But in the meantime, they're unlikely. One of the things I would say is they're unlikely to do significant harm. Again, thanks for listening.